Good afternoon, ladies and gentlemen. My name is Philip Hilton. I am the Director of External Affairs at the National Black Leadership Commission on AIDS, and I appear before you this afternoon to offer remarks on behalf of my President and Chief Executive Officer, the Honorable C. Virginia Fields. Finally, after more than three decades, yes, billions of dollars spent and tens of thousands of lives lost, the federal government is on the verge of implementing a strategy to address the HIV/AIDS-fueled public health crisis that continues to exact a heavy and disproportionate toll on African Americans and other Americans of color. We applaud President Obama for the release of the National HIV/AIDS strategy. However, the American people deserve a strategy that contains action recommendations and timelines that reflect a real sense of urgency about addressing HIV incidence and prevalence in African American communities. Black men, women, and children have carried the disproportionate burden of our domestic HIV/AIDS epidemic for far too long to do anything less. For the nearly 25 years that the National Black Leadership Commission on AIDS has been in existence, we have urged our government to use epidemiological data to ensure that resources follow the trends of the HIV/AIDS epidemic. Our steadfast advocacy in this regard is born of epidemiological data, which consistently, year after year, emanates from the Centers for Disease Control and Prevention, state and local health departments indicating that African American men, women, youth, and children suffer from and have the highest rates of HIV infection and AIDS in the nation. HIV/AIDS roots in Black America are deep because multiple epidemics of chronic diseases, benign neglect, racism, abject poverty, insufficient funding, inadequate housing, poor education, high unemployment, high rates of incarceration, widening disparities in healthcare based solely on race and ethnicity, stigma, discrimination, and homophobia, among other cofactors, provide a perfect environment in which HIV/AIDS and other diseases can take root and flourish. Our efforts to defeat HIV must be inextricably linked to our efforts to address the structural drivers that feed HIV. There is much that we already know we ought to be doing about the allocation of resources to meet the needs of populations that are already heavily infected and affected by HIV/AIDS. We must develop an effective surveillance system that measures HIV incidence and prevalence for Black women. We must provide adequate funding, technical assistance, capacity building, and infrastructure development to minority-focused organizations that we expect to implement effective programs and initiatives for reducing HIV infection. The federal implementation plan must be unequivocal in its approach to prioritizing programs and funding to effectively address Black America's onerous HIV/AIDS public health emergency. Ladies and gentlemen, my friends, the National Black Leadership Commission on AIDS continues to stand shoulder to shoulder with you, other key decision makers in President Obama's administration, our colleagues in the AIDS community, and all community stakeholders to ensure that our federal government implements an effective national HIV/AIDS strategy. On behalf of Ms. Fields, I thank you for your time this afternoon.
Thank you. Leo Reed. Carol Treston.
I think I'm last. Good morning. Good afternoon. My name's Carol Treston. I'm the Executive Director of AIDS Alliance for Children, Youth, and Families. Our constituents are HIV providers, primarily Ryan White Part D, but also prevention providers and the communities they serve. Women, children, youth, and families living with and affected by HIV in the U.S., Puerto Rico, and the Virgin Islands. I am here today on their behalf. I'm also here today to formally shine a light on the gap in the National HIV/AIDS strategy and that youth are not acknowledged as a population at highest risk for HIV. And to briefly note the potential consequences of that decision and to ask PACHA's help in addressing this. First, it's in direct contradiction to the fact noted on page 2 of the strategy that 1/4 of new infections are among young people ages 13 to 29. I'm still wondering why this approach of not calling out youth as a specific risk group occurred, and since we have been told all along that this is a living document, I am optimistic that this can be changed with your help in the future. I know the people who have developed the National AIDS Strategy and you are good people with good intentions, and I have heard various reasons for this gap and do want to understand it better. One rationale solution I have heard is that youth with HIV or at risk for HIV can be considered in other stated categories, such as young MSMs within the MSM category, or adolescents can be included in black men and women or Latino-Latina category. Clinicians long ago acknowledged that adolescents, now defined up to 24 years old, are not almost adults. They are their own dynamic group with changing and fluid identities, even including changing sexual and racial self-identities. They have special communication and engagement styles and challenges and unique priorities and time schedules. And I have a 16, 19, and 21-year-old in my family, and I can tell you that their time schedules are unique. And then we layer on top of this issues of autonomy, financial independence, dependence, insurance and consent, and other areas of vulnerability. And it's easy to see that youth are not simply young gay men or young African Americans. While they may have commonalities with their older ancestors, they all have much more commonalities amongst themselves, and they'll tell you this themselves. So why is it important to call out youth separately in the National AIDS Strategy? Some people have said, why are you concerned about words on paper in a document? It's more important about the implementation. Well, we all know that words in an important document like the National Strategy have heavy meaning, and decisions are made according to what's in there and what's not, even if the exclusion was intentional or not. So, for example, where does an agency place its priorities in programs and funding? A smart one will look at community needs, yes, but also look at the national strategy for guidance. Those of us who have run programs and organizations on the ground know this. We have multiple community needs, and we scan guidance looking for keywords and write our proposals accordingly. And some of these proposals actually turn into programs, and with resulting implementation and service delivery models. I want to make sure that the special needs of adolescents and young people are met, whether they are gay, questioning, straight, but tried it once, black, Latino, mixed race, teen moms, transgender, undocumented, or perinatal. Again, they all have more in common with each other than those that aren't young people. So effective prevention and care programs know this, young people know this, and they have told us this. They have also developed tremendous suggestions for strategy and benchmarks, primarily at an ONAP convened meeting around youth, and I've included a summary of those recommendations for your review. And then finally, the importance of what words are included and the weight and priority that they are included in the document also impacts on what federal agencies are involved, their budget priorities, and who is held accountable. The other gap in the national strategy was that the Department of Education wasn't included formally. And this is not surprising if the youth weren't called out. And to me, this is just a waste of a great opportunity. A strategy is supposed to be a combination of goals that are achievable and some that are a bit of a stretch. And if we as a community can't insist that the Department of Education be involved in planning for the future of our young people in terms of life skills that include comprehensive sex ed and HIV prevention, we'll still be having the same challenges in prevention for years to come. So I'm glad to hear that the Department of Education is now involved in some conversations about the National HIV Strategy, but I ask you, PACHA, to insist that they be a formal implementation partner. And so in closing, I ask that you help to address this gap for youth in the National Strategy by insisting that in the next version, youth be called out as a unique group, and secondly, that the implementation plans that you're all reviewing include youth-specific goals and strategies for prevention, access to care, and reducing disparities. And thirdly, that the Department of Ed be a formal partner in the implementation plan. Thank you.
We would like to thank all of the speakers this afternoon for their comments. We'd also like to remind the listening audience that you have until next Thursday to submit, if you choose, written comments. You can send them vis-a-vis the internet through email to us, or you can call us and we will take short statements via phone, very short. But we do appreciate public input, and we appreciate all of the speakers this afternoon. I'm going to turn it back over to our chair.